For countless women, large breasts are not just a cosmetic concern. It's a daily struggle with pain, poor posture, and self-consciousness. Dr. Anna Pavlov is a board-certified plastic surgeon. She joins us to talk about breast reduction surgery, how it works, and why more patients are choosing this option. Thanks so much for joining us today. Can you tell us about what the surgery involves and who may be a good candidate for it?
All right, thank you for having me here. I'm very happy to be here and talk about breast reduction. It is the most common procedure we do, and it is by far the best procedure we do. At least in my opinion, it's my favorite procedure to do in plastic surgery. So the patients that we see who commonly come in for a breast reduction surgery are usually complaining of, and in medicine we say complaining when we mean that there's an issue.
Yeah.
The issue that they have is neck pain, back pain, shoulder grooving from their bra straps, rashes under their breasts, poor posture, difficulty exercising, difficulty sleeping because of heavy breasts, things like that are most common reasons.
So how does insurance typically work for this? Is this a surgery that's deemed medically necessary, or does it depend on the case? How does that work?
It actually can be medically necessary. Most of our patients who come in for a reduction often do qualify for insurance coverage. Insurance can be tricky. They'll make patients jump through certain hoops, most commonly completing a course of conservative treatment. And conservative treatment can be as simple as taking ibuprofen for your neck pain, or it can be as complicated as getting an MRI to check your cervical spine, or having to complete a course of physical therapy.
Oh, wow.
I've seen all sorts of different insurances require different things. Most commonly, it's just conservative treatment, usually for a 3-month period, sometimes 6 months. One insurance I saw required a year of conservative treatment before they would cover it. So it is very different for different insurances.
Right.
At my office, we have our insurance lady, Libby, who goes over all of the requirements with our patients and works very closely with our patients to help them get the surgery covered by insurance.
So what results do people usually see, and how long do the benefits last? Is it for a lifetime?
So the results do last a lifetime, but that also kind of depends on what stage in life you're at. For example, I recently saw a teenager who already has large breasts in my practice, and I had to tell her, you know, you're kind of a little young. If we reduce your breasts now, they'll just grow back because you're not done growing.
Right.
Your breasts can grow back with pregnancy and even with menopause due to these hormonal changes. But generally, once you have your breasts reduced, it should last for the rest of your life.
Yeah, I mean, is the recovery kind of the same as implants? Because I've heard those that's a hard recovery. Is the recovery easy for reduction surgery?
Recovery is not bad. Most of our patients say it's not very painful to have done. They'll take prescription pain medicine for 1 or 2 days after surgery and then switch to over-the-counter medicine. So from a pain perspective, it is not difficult to recover from. The recovery really just comes into letting your incisions heal. We do have to make a lot of cuts on the breast in order to reduce their size, and it just takes time for the cuts to heal. So I usually tell patients recovery is about a month, and the activity restrictions are in place for a month, usually able to get back to some light activity at 2 weeks, and then normal activities by 4 weeks.
Okay, great. Well, people can just schedule an appointment with your office then?
So you can call and schedule an appointment for our cosmetic patients. The consult is free of charge. If you're trying to get your reduction covered through insurance, the best way is through a referral from your primary care doctor.
Okay, great. Well, great information for us today. We really appreciate it. Thanks for being with us.